Automated blood cell analysis. So automation basically replaced manual testing back in the 1980s. Automation allows a more efficient workload management and timely diagnosis. An overview of hematology analyzers. So we have some major manufacturers that you'll probably see at your work sites or clinical sites. So we have Abbott, Toriba, Siemens, Beckman Coulter, and Sysmex. These analyzers commonly employed methods such as electronic impedance, radio frequency, flow cytometry, and light scatter to analyze blood cells. Some basic components is they have hydraulics for fluid movement, aspirating units to draw blood samples, dispensers and diluters to prepare specimens, mixing chambers to ensure sample homogeny, aperture baths where cells pass through sensors, and hemoglobin meters for measuring hemoglobin concentrations. We have computer software capabilities where the modern hematology analyzers are now equipped with sophisticated computer software that can help handle data acquisition and processing, result interpretation and flagging abnormal values, quality control management, and connectivity for laboratory information systems. For calibration, so calibration is the process of electronically correcting an instrument to minimize analytical bias and ensure accurate test results. It aligns instrument readings with known standards. For CLIA, so under CLIA regulations, calibration verification must be performed initially when an instrument is put into service, at least every 6 months and thereafter. This helps to maintain consistent instrument performance and compliance. For instrument limitations, so common limitations described in operator manuals can include inability to distinguish cells from debris or junk, which can lead to inaccurate counts, sensitivity to specimen-related factors such as cold agglutinins, which is where red blood cells start to clump, icterus samples, which are there's bilirubin interference, and or lipemic samples where they have a high lipid or fat content in the sample. It can also affect patient age and improper specimen handling and test accuracy. So we need to make sure that we understand these limitations so we can make sure that we are interpreting the results and troubleshooting appropriately. Automated blood cell analysis plays a crucial role in the classification and differentiation of anemias by providing precise measurements of red blood cell indices, such as those MCV, MCH, and RDW. This can help clinicians distinguish between microcytic, normocytic, and macrocytic anemias and help guide further diagnostic steps. So automated analyzers assist in the differentiation of thrombocytopenias by accurately counting platelets and identifying abnormalities such as platelet clumping or large platelets, which can help distinguish between decreased production and increased destruction cases. The use of automated white blood cell differentials can significantly reduce manual workload in the clinical laboratories. It can increase efficiency and throughput. Flagging systems within analyzers alert technologists to samples requiring manual review, ensuring abnormal cells are still not missed. Detection of abnormal cells and nucleated red blood cells are automated or can be automated by systems in diagnosing hematologic diseases and evaluating bone marrow response, particularly in conditions such as anemia, leukemia, and marrow infiltration. Histograms and cytograms, these are generated by the hematology analyzers, which can provide graphical representations of cell size and internal complexity, which can identify abnormal cell populations and help support diagnosis. Automated systems also extend to body fluid analysis, where cell counts and morphology can provide valuable information in evaluating infections, malignancies, and other pathological states. Finally, careful selection of hematology analyzers is important to match clinical needs, so we need to consider factors like test volume, desired parameters, the budget, and integration compatibilities with laboratory information systems, which can help optimize patient care and laboratory workflow.